Mettler has been Nevada County's Chief Fiscal Officer since July 2024. She has served as the county's Health and Human Services Chief Fiscal and Administrative Officer since 2020 and has 23 years of experience in managing budgets and programs in local government. Welcome, Erin. Nice to have you here at the studio.
Thank you, Lynn. Pleasure to be here.
What's a fiscal officer to do? There's so much to talk about and so much going on. I was thinking that it's been a year, starting from the DOGE cuts that affected us directly as far as phase 2 of the fire mitigation grant that is not, I assume that phase 2 is not going to happen, at least in the
Not with that funding, for sure.
Yeah, right. And so that was DOGE, and then the CalFresh, SNAP program being affected by the federal cuts and so on and so forth. I mean, it's been quite a layered, multi-layered, hit, many hits. Let's put it that way.
Yeah, and unfortunately, a lot of the impacts that we're going to see in Nevada County are yet to come. And so while the headlines are the cuts occurred, we didn't necessarily feel impacts right away in Nevada County. It takes a while for that federal action to trickle down to state of California and then on to Nevada County. And so we're expecting a fair amount of change coming in 2026. That's when H.R. 1 starts to be implemented.
Because the provisions in H.R. 1 roll out over several years.
Correct.
Right. So it's we're not feeling the worst of it yet.
Unfortunately not. I think if there is a benefit, it is that we have time to plan. And the side caveat of that is we're not sure what we're planning for.
Right.
Because the federal government and the dollars that come down to state of California still have to go through the state's budget process before we as the county understand kind of the direct impacts that we will see and that our residents will be feeling.
So then the federal shutdown complicated the already known factors of HR 1's implementation. Then the federal shutdown happened, which affected a lot of the departments here. So it's a muddle. So how do you even begin to plan? I know that you're heading into the county budgeting process as of January, correct? The workshop, the supervisor workshop begins in January.
Yeah.
So this whole process will come. But I'm sure leading up to January, now you have maybe 6, 7, 8 weeks or whatever to plan. Do a skeleton outline-ish, of what the budget could look like.
Sure. I think it's important to understand that the county's budget is not solely impacted by H.R. 1 or by federal dollars. We do have local dollars that also go to fund our services. And so the portion of the county's budget that is being directly impacted by these federal changes are really primarily Health and Human Services Agency, which is our social services, behavioral health, public health areas, some child support as well. And then on the fire mitigation side, our Office of Emergency Services, they received that kind of impact early on with the DOGE cuts that you talked about. So it's important for us to understand where our money goes, how much of it that we need, both in terms of providing the staff support necessary to carry through the programs as prescribed by the state and federal government regulations, and then also the direct benefits to our community. That's what the county is responsible for, determining eligibility for those federal and state benefits.
Wow. So what's the inkling? How are you going to vet the people who need to qualify for those benefits? How do you do that?
We do that every day. We have an eligibility team through our Department of Social Services, and they meet with people all day long, every day. They're able to kind of assess their eligibility for certain services, including the CalFresh and SNAP dollars, including CalWorks program. And really, they're the ones that are going to be impacted because now instead of a 1-year certification or eligibility period, it's every 6 months or every 3 months.
Yeah.
And each person, each individual is going to have a different circumstance. And so really that requires us to try and strengthen our training, make sure we're fully staffed, make sure we are up to speed on all of the changes, and that our staff are going to be knowledgeable so that when the January 1 implementation timeline kicks off, we're ready to hit the ground running.
Right. So it's training the staff, but it's also sort of public information, like giving people the what the requirements will be. Actually, teaching them what has changed and how they can meet the requirements.
Yeah, and part of that is a one-on-one kind of counseling type basis where folks can come into our social services department and ask those questions. And so being able to have a person at the front counter that's knowledgeable enough to give the basics of information. We have some media press releases queued up, ready to go. Our website is a wealth of information when it comes to those kinds of basic questions. But because the requirements are nuanced, they are required on number of dependents, on your annual income, on what those sources are.
Right.
That individualized attention really does become critical.
How many people in the county does this impact?
Right now, we have about just 12,000 on the CalFresh and SNAP program. Right. But overall, our Department of Health and Human Services provides services for about a third of our county residents in some way.
Wow, that's a lot of people out of 100,000 people.
Yeah, and so not everyone is going to have a direct impact, but I think overall we're planning for different levels of impact. And what that really means is making sure, again, that our staff are as knowledgeable as they can be so that they can help. The county is here to help residents navigate through the technical language of legislation.
Right. I'm curious, when we read that the county awaits instructions from the state, and this, of course, the state has to do their budget first before you can do your budget, or it impacts your budget, and the whole, you're sort of an arm of the state, right? So how do you communicate with the state? I mean, when there's some nuance, when there's something that you're waiting for instructions about how to implement HR1, for instance, do you get an electronic memorandum? Does somebody pick up the phone? Do you have like a one-on-one relationship with someone at the state level who's the Nevada County person who can help you navigate? How does that work?
All of the above.
Okay, good. All right. Okay.
Yeah, so each of our safety net service areas generally have a state association, which comprises all 58 county representatives. And so our staff attend those meetings on a monthly basis. Each association will have a website, a wealth of information. They do issue notices to us, which are written formats of protocol, of procedure.
Right, confirming what you're verbally speaking about. Got it.
And then we have several opportunities throughout the year to have phone calls, Zoom calls, conferences. There isn't necessarily a lack of opportunity, but I will say sometimes they're just as in the dark as we are in terms of what regulations are changing.
Right.
And they do have their marching orders from the state legislature. And so really when the governor's budget comes out in January of 26, that's going to be our first indication of how the state of California plans to navigate the impacts of HR1.
Right. And that's pretty much right around the corner.
It is.
So there'll be a lot happening in January when you come back from break, and and then it's time for Nevada County to do the same, right? The trickle down.
Yeah, and our fiscal year is a July 1 to June 30th, whereas the state and the federal government is October 1 to September 30th. So we already have a 6-month off-cycle gap between the budgets, which is good and bad, right? We plan for that, and we're able to navigate the changes, but we're also kind of in a holding pattern waiting for them to reveal, if you will, what their plan is.
Right.
And usually by the time that state budget is completed, we're well into our county budget process. And so we navigate that through cash that we have in the fund balance. It's kind of like our savings account that's able to navigate kind of that 6-month gap. And then we also have pretty robust forecasting tools that we use within our departments for those services.
Sure, I'm sure you do. And I would say that coming out of the federal shutdown is a relief in the sense that you're not in this holding pattern. You have more concrete information, such as it is, moving forward.
Yeah, but certainly with the shutdown, we knew that October benefits would be whole for our CalFresh SNAP folks, but we had no idea about November. And in fact, we were mobilizing to support the local food banks and interfaith food ministry. Should those benefits had not materialized, we were prepared to help however we can. Unfortunately, we don't have the dollars that go on the EBT cards. That's the state. We just qualify the residents. And so we're really not able to backfill that loss of funding should it have occurred.
But you can support the support teams, the food banks. Got it. Did the November payments come through
They did.
Fully.
They were a couple days delayed for folks. We do a staggered benefit rollout from the first 10 days of the month.
Right.
And so the first few days did not come because the shutdown was still in play.
Right.
And then as soon as the shutdown was gone, then the benefits came pretty immediately. And if folks still haven't received their benefits, then they can and should call the county, and we can help navigate their specific circumstance.
Okay, they know to call Health and Human Services for sure.
Mm-hmm.
Okay, well, happy holidays, because you're going to need a happy holiday diving into the January madness. Best of luck to you, and perhaps we'll have you back and see how it's going.
Yeah, thank you so much.
Thank you, Erin. Nice to meet you.